Okay, this is going to be the digestive system running from the duodenum to the anus. First, I want to talk about the alimentary canal, or just the tube that runs through you. The parts of that canal are the lumen, mucosa, submucosa, muscularis externa, and serosa. Lumen is just the name of the hole. Mucosa, the lining of mucus inside it. Submucosa, kind of the same thing, but below that. Muscularis externa, that's the muscular part of the tube that's doing the peristalsis contraction, and then the serosa, which is just the outer lining of the tube. Okay, moving on to the small intestine here. A couple things I want to highlight is we got all the pancreatic juice and everything from the pancreas and the gallbladder here, and the bile, and that squirts into the first part of the small intestine called the jejunum. And then as you move through kind of the last half-ish of the small intestine is the ileum, and then it moves towards the ileocecal sphincter. And so what happens is here is all your nutrients are absorbed. Food will spend about 3 to 6 hours in here, and the total length is 13 feet. So that gives a lot of time and surface area to absorb all those nutrients. Then the food, and this is also where the food starts getting broken down into sections as it's passing through. Then you have the cecum here, which moves to the large intestine. So large intestine, the cecum, this beginning part, the appendix is right here, so if this becomes infested with bacteria, then that is called appendicitis, and they'll just cut that off. The cecum right here, the beginning of the small intestine, large intestine. Then you have the ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and the anus. Yeah, so some facts about this. Food will spend about 12 to 24 hours in this section. This is where your poop is held. When your poop has the ridges on it, that's from these little bumps on the large intestine. Those are called ostra. And then you have two sphincters that control kind of where you poop. And that would be, you have internal anal sphincter, which would be more up here, and it just the smooth muscle that pinches off. And then what you control is made of skeletal muscle, the external anal sphincter. This is when you control, so when you get the urge to go, that's when the poop's passing past the internal anal sphincter, and then when you allow that to come out, that's when the external anal sphincter opens up and allows that to pass. Just some words. Defecation is the technical word for pooping, and then when you do that, you can use the Valsalva's maneuver, so basically when you suck in air to increase intra-abdominal pressure so you can push out, and then you have to be in parasympathetic for that to work, so that means you're not in flight or fight mode. And then I want to show you this picture here, just so you can see these blood vessels. They are the ones, if they swell up large, then you get hemorrhoids. Okay, so some additional stuff I wanted to go over. Bacterial flora, just you have bacteria in your gut that help you digest food. And when you have gas for farting, that's usually created in here, and that's the bacteria when they're doing their metabolism and digestion. That gas is produced as a byproduct. Then you have this mesentery and peritoneum. Mesentery holds the intestines together, so you just couldn't rip this tube out like a sausage. And then peritoneum is the cover that kind of lines everything. And then a disease would be irritable bowel syndrome, or IBS, so basically the GI tract is inflamed.